Hi, my name is Alexis Archer. I'm a student at VCU School of Pharmacy.
Hello, my name is Anabil Sen, and I'm a PhD student at the Department of Epidemiology.
My name is Deshaun Simon. I'm currently studying dentistry.
My name is Claire Hughes. I am in the Doctorate of Nursing Practice program. My husband, we met working in the emergency department together. We both are very passionate about bettering ourselves to better care for our patients. He was very willing to work up to 4 jobs as a firefighter paramedic. The scholarship relieved a lot of stress off of his shoulders as well as mine. It's allowed me to enjoy school, enjoy education, because I'm not stressing in the back of my mind, like, am I gonna have to pick up overtime? I watched my sister in the pediatric intensive care unit after surgery related to her new cancer diagnosis. The ever-constant presence that actually relaxed the situation were the nurses. Being that force that is somebody's confidence, that is their helping hand through one of the worst days of their lives. That's what I strive for every day.
I did my medical school back home in Bangladesh. I would see people from different parts of the country, from different socioeconomic backgrounds or educational status. Social factors were a big dictator of health, and that sort of prompted me to think more upstream about social determinants, about epidemiology.
What about infectious disease? Are you seeing any of that?
VCU has a unique dedication towards community engagement, and when you engage a community, it's mostly about looking at them as the masters and the designers of their own intervention. The scholarship gives you that academic encouragement, that inspiration. You can focus completely on your dissertation. Without the scholarship, that wouldn't have been possible.
My mom is so excited for me. She's my biggest cheerleader because I have to get up so early to drive to the hospital. She's up at 5 a.m. with me on the phone. Proud isn't even enough of a word to say how I know she feels. My father was a physiologist as his field of work. So I grew up around science, around STEM, being encouraged to study, to do well in school. When he was diagnosed with cancer, I went through a lot of emotions, obviously. My whole family did. In particular, the pharmacist that we spoke to, she came from out of her office into our room, and she sat there for an hour of her workday with us to go through this new diagnosis and everything that was going to come with it. She didn't have to do that. A lot of people won't.
Okay, so this was a 6-year-old who did PFT. So the first thing that we always think about.
I want to be on the side of medicine that helps families and gives them the good news and talks about what we can do to save patients and to help patients. Being able to earn a scholarship and having the tools necessary to do well in school, I can't thank the school enough to be able to help my mom in that way and to help me in that way so that I can do what I've always wanted to do.
I didn't really know what I wanted to do in high school. I kind of just went into undergrad thinking, I know I like science. It's a very stressful time for everybody, and a lot had happened during that year, so I ended up developing a bad eating disorder, and it caused a lot of dental problems for me. That was the first time I had cavities. Ended up restoring them, and it felt great. After that point, I felt empowered to want to do more. I was volunteering at a RAM clinic actually this past year. I had a patient, she didn't want to come in. It's been 10 years since she saw a dentist. A family member of hers had their teeth pulled out by their dad with no anesthesia, and so it scarred her for life. And then the dentist ends up telling me hey, she's gonna need extractions on 3 teeth. And I saw her later that day, and gosh, it'll probably get me crying here soon. And I was just like, how are you doing? And it's she had this little wispy voice, and she was just like, hey, I'm fine. And I wanted to break down in tears right there. Because it was today was a step for her. And it was a great step. I'm a first-generation college student, so my family doesn't really come from money. I honestly never knew I would end up in the position I am today. And getting a scholarship is much more than just the monetary. It's like you're making an impact, of course, on me directly, but you're impacting others way more than what you realize.
I don't know that I would be able to do graduate school on my own without this scholarship. I want to thank you for changing my life.
Thank you for believing in education. Thank you for believing in public health and for science and for investing in science. All of this wouldn't have been possible without your generous support.
To not have this financial barrier be in place to prevent them from doing what they're smart enough to do, what they're determined enough to do, it can break generational curses. I know that I will be in the position to do the same for those that come after me. It makes such a difference in people's lives.